Hello there. My name is Dr. Lippy Roy, and welcome to my show, Health, Humor, and Harmony. Imagine these scenarios. You're celebrating happy hour with some coworkers at your local bar, and you down a couple beers. Or you wind down at home after a long and stressful day with 1 or 2 glasses of wine to calm your nerves and relax. Or you have memories of childhood when your dad would angrily knock over furniture and shout at the family while consuming almost an entire bottle of vodka. The reality is that all of these situations play out every day all over the world. Did you know that alcohol is the most commonly used addictive substance in the United States? Did you also know that alcohol accounts for nearly 180,000 deaths each year in the US? April is Alcohol Awareness Month, and as an addiction medicine doctor, I've cared for scores of patients with alcohol use disorder. In today's episode, I'll talk about 4 things you need to know about alcohol, including its impact on the brain, its dangerous popularity among women, and the real way alcohol addiction should be treated. Spoiler alert, it's medications. Let's get started. Fact number 1. Alcohol addiction is the second most common substance use disorder in the world. Tobacco is number 1. According to the National Institute on Drug Abuse, alcohol use disorder, or AUD, is the most common substance use disorder, or SUD, in the US. AUD transcends race, ethnicity, gender, social, and economic status. Celebrities such as Billie Holiday and Amy Winehouse have died from alcohol-related causes. Did you know that more Americans die in 1 year from alcohol than total US casualties from World War I and the Vietnam War combined? Despite its wide prevalence, less than 10% of people with AUD get evidence-based treatment. I'll talk about more of that later. Fact number 2. Alcohol addiction is a chronic disease of the brain. It is not a sign of moral weakness. How many times have you heard or said to a person with alcoholism, "Get your act together," or "You're destroying your life," or "Don't you care about your family?" I get it. Most of these sentiments are born out of frustration, anger, and concern. But they're also rooted in stigma, in judgment, and lack of understanding about alcohol's massive impact on the human body. Alcohol can adversely affect every organ, including the heart, liver, pancreas, and the brain. Alcoholic beverages like wine or beer can activate the brain's reward center and release the pleasure neurotransmitter dopamine. This is why in low to moderate amounts, alcohol can help us feel happier, relaxed, and social, i.e. feelings of euphoria. Unfortunately, chronic, heavy alcohol consumption can damage different parts of the brain, killing neurons and shrinking the brain, which can lead to poor memory, impaired judgment, dysregulated emotions, and behavioral changes like aggression, anxiety, and impulsivity. Fact number 3, alcohol is worsening the gender gap. Women are catching up to men, and not in a good way. Did you know that alcohol use and misuse are rising among women? While men are still 2.8 times more likely to die from alcohol-related causes than women, recent studies show that among women, alcohol use disorder and alcohol-related deaths are increasing. In addition, for the first time in history, women are binge drinking more than men. Alcohol-induced complications, including liver disease and gastric bleeding, rose 33 to 56% among women aged 40 to 64 during COVID compared to pre-pandemic times. So why are women drinking more? The reasons aren't exactly clear, but experts believe that women are using alcohol to cope with increased stress. The COVID pandemic disproportionately impacted women who were forced to quit their jobs, care for children and elderly relatives, and face an increase in domestic violence. Alcohol, like many addictive substances, can numb feelings of pain and trauma. Fact number 4. Detox is not first-line treatment for alcohol addiction. And yet, if you ask most people how alcoholism is treated, they'll likely say detox or AA. So, let me set the record straight based on science. First, what's detox? Detoxification means a person is slowly weaned off their dependence on alcohol using medications like benzodiazepines or phenobarbital, which decrease the risk of potentially fatal seizures, i.e. DTs or delirium tremens. Detox is considered acute treatment, not long-term treatment for what's clearly a chronic illness. Alcoholics Anonymous, or AA, is a peer-led mutual support group that can provide an additional layer of support as adjunct therapy. So what's first-line treatment for AUD? Medications and behavioral therapy. 3 FDA-approved medications, naltrexone, disulfiram, and acamprosate, can reduce cravings and drinks consumed. Naltrexone has been shown to be the most effective. Several other medicines are currently off-label, but can be helpful. These medications, combined with behavioral therapies led by health professionals, can help people with alcohol addiction achieve long-term recovery. The crazy and maddening thing? Of the 30 million Americans with an alcohol addiction, only 8% are receiving evidence-based treatment, and only 2% are getting medicines. Can you imagine if only 2% of heart attack survivors got aspirin or cholesterol-lowering medications? Remember the good news. Most people with addiction, once connected to the appropriate treatment and recovery services, get better. So, what can you do to help? If you know someone struggling with alcohol use disorder, call the SAMHSA hotline for free, confidential, 24/7 assistance. You can also learn from, donate to, or volunteer with ASAM, NIAAA, Hazelden Betty Ford, Smart Recovery, or Women for Sobriety. Well, here's your joke of the day, spring themed. The doctor asked, "Did you know it's allergy season?" And the patient said, "You've gotta be pulling my leg." Well, that's all for today. Be sure to subscribe to my YouTube channel, write comments below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.